So how has COVID affected Quia Delta financially?
It is like every hospital across the country. It's been devastating, frankly. Not because the cost of combating the virus and responding to it hasn't really increased our expenses, but our revenue has plummeted. Every hospital, the financial engine of a hospital is surgery, without a doubt. And to have closed down 40% of our elective surgeries, which also tend to be the most profitable surgeries that a hospital does. So hospitals literally across the country have seen enormous declines in their revenue. In our spirit of transparency, again, we're a public agency, Quia Delta posted a $5.7 million loss in the month of March alone, which is our highest in our history, 60-year history. And March was only a partial month. We're fully expecting that April will be even worse from a financial performance standpoint. Now, unfortunately, with those, the financial consequences, we, like so many hospitals and businesses across the country, are trying to find ways to survive and are trying to find ways, how can we reduce our costs? And labor is our number one expense for a service company like us. So unfortunately, we've had to cut the hours of many of our employees. We've had to dock them, and we've now just recently had to furlough them, which is essentially a temporary layoff. St. Agnes over the weekend announced they laid off 175 employees. Adventist Health has laid off hundreds and hundreds of employees. Family Healthcare Network here in town, I think, has laid off 350 employees. It's the most awful, saddest part of this virus, other than the passing of human life. But it's been really hard. And especially when you think about just a couple months ago, this hospital was bursting at the seams. And we had a staffing shortage. We couldn't find enough staff to care for all our patients. And then just in a matter of a couple months, you're on the complete other end of the extreme. So we're helping all of our employees. Fortunately, the federal government has stepped up with additional supplemental unemployment benefits for employees that have lost their jobs. So we help employees enroll in state and federal unemployment. I fully expect that we'll be bringing all of those employees back, that it is a temporary condition, and that when this thing has finally passed us and we can get back to more normal operations, when we enter the flu season again, we're probably going to be a very busy hospital. And so we're checking on those employees all the time, make certain they're doing all right. We still consider them to be part of the Quia Delta family, and we absolutely will be bringing them back. One thing, and I know this will never make us whole, but definitely the stimulus packages that have been passed by Congress, hundreds of billions of dollars have been earmarked for hospitals. We did receive our first payment of $11.2 million a couple weeks ago, and we are going to take that into income and spread it over some period of time. We hope millions of additional revenue will come in. It will never make us whole, but it will help us survive this.
Right.
So that's